Today, we are diving into one of the most fascinating and honestly mind-bending topics in all of neuroscience: phantom limb pain. We're going to explore exactly why a part of the body that is no longer there can still cause very real and often very intense pain.
It's a question that just seems to defy logic, doesn't it? And for people who go through this, there's often this terrible fear that nobody will believe them, that their pain will just be written off as something they're imagining. So let's start with the most important thing right up front. If you are experiencing this or know someone who is, I need you to hear this loud and clear. The pain is 100% real. The sensations are genuine, and the source of that pain isn't some kind of weakness. It's actually a sign of an incredible, complex process that's unfolding inside your brain.
Now, to really wrap our heads around phantom pain, we first need to distinguish it from another type of pain that can occur after an amputation. It's an important difference.
So on one side, you've got what's called residual limb pain, or just stump pain. This is pain that's located right at the site of the surgery, and it's usually caused by something physical, like nerve issues there or a problem with the prosthesis. But what we're focusing on today is phantom limb pain. This is the really strange stuff, the throbbing, the tingling, the aching that feels like it's coming directly from the foot or the hand that isn't there anymore.
And I want to be clear, this is not some rare fringe condition. Not at all. In fact, some studies show that up to 95% of people who have an amputation report some kind of related pain. Phantom sensations are almost a given, and for a lot of people, those sensations become painful.
You know, this mystery has been around for centuries. We have records of surgeons describing it way back in the 1500s. It even got its official name, phantom limb pain, from a doctor observing soldiers after the American Civil War. The big difference is that today, with advanced brain imaging, we can finally pull back the curtain and see what's actually causing it.
So what is going on? Well, to find the real answer, we have to take a journey away from the limb itself and go straight to the source, up into the brain, which basically holds a living map of our entire body. For a long time, the best guess was that the problem started and ended with the nerves in the stump. See, when nerves are severed, they can sometimes heal into these tangled, jumbled messes called neuromas. The analogy everyone uses is faulty electrical wiring, and it's a good one. These neuromas can just fire off random, chaotic signals that the brain reads as pain. And while that's definitely a real issue for stump pain, it's not the full story behind the phantom.
No, the real key, the true answer to this mystery isn't found in the limb. It's in the command center that used to listen to that limb, the brain itself.
The key concept here is a big term, but a simple idea. It's called cortical reorganization. This is basically the brain's amazing ability to rewire itself, to literally redraw its own maps when a major source of information suddenly vanishes.
To really get this, I want you to picture a map of your body laid out inside your brain. In a specific area called the somasensory cortex, every part of you, your fingers, your nose, your toes, has its own little patch of land, its own dedicated territory.
Okay, so what happens after an amputation? Well, the piece of territory on that brain map that belongs to, say, your left hand, it suddenly goes dark. It's like a radio station that's gone off the air. Total silence, no more signals.
And here's the thing about the brain. It absolutely hates empty real estate. It doesn't tolerate silence. So those neighboring territories on the map, they start to move in. They invade the quiet space. So for example, the parts of the map for the face and the shoulder, which happen to be right next to the hand area, they begin to expand and take over that now silent hand territory.
And this rewiring leads to some incredibly strange results. The neuroscientist V.S. Ramachandran made this famous discovery where he'd gently stroke the cheek of a patient who was missing an arm, and the patient would feel the sensation in two places at once. On their face and in their phantom hand, the signals from the face were literally spilling over into the old, rewired hand territory. And this cross-wired system is a huge driver of phantom pain.
Okay, so this is the crucial takeaway. The pain is coming from a confused, rewired brain map, which leads to a really cool question. If a scrambled map is the problem, could we maybe trick the brain into unscrambling it?
And the answer, amazingly, is yes. There's a treatment that is so clever and so simple because it uses the brain's own rules against it. It all comes down to one fundamental principle. For your brain, seeing is believing.
It's called mirror therapy, and here's how it works. A patient puts their existing, intact limb on one side of a mirror. When they look into that mirror, it creates this incredibly powerful illusion. It looks just like their missing limb is there, whole and healthy. Then, as they start to move their intact hand, their brain sees the reflection, the phantom limb, moving perfectly without any pain at all.
This visual feedback is like a super powerful signal that the brain has been desperately missing. Vision is such a dominant sense that it basically overrides all those other confused, jumbled signals coming from the rewired map. The brain finally gets this reassuring message that the limb is okay, that it's moving, and that helps it start to untangle that messy wiring.
But you might be thinking, okay, that's a neat trick, but does it actually work? That's a fair question. Let's take a quick look at the evidence. So here's the bottom line from brain scan studies. Scientists have found a direct link. The more that brain map has been reorganized, the more intense the phantom pain is. But, and this is the hopeful part, when therapies like mirror therapy start to reverse that reorganization, the pain levels go down right along with it. The connection is really clear.
So putting all this together, what's the action plan? What does this mean for someone who is actually living with phantom limb pain every day? It means we have real strategies that work with the brain, not against it.
Now, while mirror therapy is an incredible tool, it's usually just one part of a bigger plan. A really solid approach often includes things like specific medications that can help calm down overactive nerves, TENS units that use a gentle electrical current to block pain signals, and, so importantly, psychological support to help manage the very real emotional side of all this.
So let's end with the doctor's note. If this is something you or a loved one is dealing with, please remember, your pain is real, it is valid, it's not just in your head, it's in the wiring of your brain, and it is not something you just have to live with. There are real, science-backed solutions out there. So take this knowledge, feel empowered by it, and go have a conversation with your doctor. Ask them if a brain-focused therapy like mirror therapy might be the right next step for you.